Good afternoon. I'll start with just introducing everyone that we have on the panel, and then of course you guys can add to it if you feel I haven't done it justice. We'll start with Dr. Feroza Dawood, a British consultant OBGYN and head of the Obstetrics and Gynaecology at Mediclinic Airport Road Hospital, Abu Dhabi. Dr. Feroza has collaborated with international colleagues to conduct clinical trials and research in recurrent miscarriage and diabetes in pregnancies. She has a master's degree in international healthcare and leadership from Manchester Business School in the UK. She is also a peer reviewer and a member of the Maternity Advisory Group of the Department of Health in Abu Dhabi with a remit to continuous improvement in women's health from birth to menopause. Welcome.
Thank you, Mira.
We also have with us Rainer Bolsinger, who holds a Diploma Kaufman from FAU. Rainer is the Chief Strategy and Chief Marketing Officer of Art of Cryo, a brand by L&R Kältetechnik. He holds a long track record in international business all around the world in areas like medical, rehab, hospitality, sports and fitness, and lifestyle solutions, and the chair of the Cryotherapy Initiative of the Global Wellness Institute in Florida, US. Welcome.
Thank you very much.
Lastly, I'm Mira. I'm the medical insurance director at an esteemed insurance brokerage in the UAE. My goal is to forge a path towards inclusive healthcare for every resident. Thank you for having us on. A quick overview of the topic that we have at hand, medical tourism. So medical tourism in Dubai has experienced significant growth in recent years, establishing the city as a prominent destination for healthcare travelers. Boasting world-class medical facilities, skilled healthcare professionals, and a vibrant tourism industry, Dubai offers a unique blend of high-quality medical care and, of course, luxurious travel experiences. While specific statistics may vary, Dubai's medical tourism sector has witnessed a substantial rise in the number of international patients seeking medical treatment. According to the Dubai Health Authority's data, in 2019 alone, the city welcomed approximately 350,000 medical tourists, and in 2022, approximately 674,000 medical tourists. These individuals sought various medical procedures such as advanced surgeries, specialized treatments, and wellness services. As the sector continues to evolve, Dubai remains at the forefront of providing world-class medical care and unforgettable travel experiences for patients from around the globe. We'll now dive into some questions for our panelists. I think we should start with maybe ways on how to define medical tourism. I think, Rainer, you might want to take this on.
If we take the definition by the Dubai Economic Ministry, they separate it in doing tourism for urgent reason to get treated on an indication. The second way is to do it for a reason which is not urgent, like dental care or more aesthetics. And the third one would be wellness and well-being, longevity. Says we talk more about preventative.
Thank you. And what factors would you say contributed to Dubai's rise as a popular destination for medical tourism? I think maybe Dr. Feroza would also want to add to that.
Yes, thank you, Mira, and thank you for the lovely introduction. I just want to start off with a disclaimer. I am not by no means an authority on medical tourism. I'm an obstetrician and gynecologist. I practice at Mediclinic Airport Road in Abu Dhabi, the capital of the UAE. But of course, Mediclinic Middle East is also based in Dubai, Al Ain, and then it has international branches in South Africa and Switzerland. And my day job is a practicing clinician. I love delivering babies, and I look after patients from delivering their babies right until menopause. And in my experience, I have noticed that I'm very passionate about women's health. I've noticed patients are now moving their focus towards preventative health care. We already have cervical cancer screening, we have breast cancer screening, but now patients are moving towards preventing, trying to also delve into cosmetic procedures, especially in my field, cosmetic gynecology, dermatology, etc. And so I see now there's a move towards this so-called medical tourism, not only from outside Dubai, but also from within the UAE itself. As Rainer said, largely they are elective procedures. And Dubai, from statistics from the Dubai Health Authority, in 2022, I think it was quoted that the financial derivatives of medical tourism was in excess of 1 billion dirhams. Why Dubai? I think because Dubai has a very good strategic geographical location, easy to access from most parts of the world, especially Asia and Europe, and then of course the GCC countries as well. So I think this is what makes Dubai a popular medical tourist destination because of its location. Just to answer your question a little bit more completely as well, the main areas that we see a burgeoning interest in medical tourism is cosmetics. So this includes aesthetics, so plastic surgery, dermatology, cosmetic gynecology as well, then dentistry, in particular cosmetic dentistry, and the last one is in cardiology as well, and orthopedics. Also gynecology, especially elective gynecology, such as IVF, but as I mentioned before, cosmetic gynecology as well.
Thank you.
May I add, I think Dubai has two more competitive advantages. First one is infrastructure. You have outstanding equipment there and a very high level of treatments. And the second, and maybe even more important point is it's super international and gives easy access for everybody. Wherever you're coming from, we will be attended in your mother tongue, which is very essential, especially if it comes to serious health problems, that you have built a trust with your customers.
Thank you. And what are the key advantages of Dubai's healthcare system that attracts international patients? I think this one ties into what we've already said in terms of like state-of-the-art international doctors that visit as well. So how would you categorize medical tourism, Rainer?
Yeah, one can distinguish by fields of treatment, let's say by indications. Is it dental? Is it beauty? Is it whatsoever? It can be defined in the way how a facility is organized. Am I traveling to a place and hospitality is included, so I have in-house services, or is it done by collaborations, that I have a luxury hotel with a concierge, a health concierge, that takes care of me and brings me in the distinguished, different specialized facilities, and the treatment aim itself, as we did before.
Thank you. And how do you believe that Dubai ensures the quality and safety of medical services that are provided to international patients?
May I answer that? Yeah. So the legislative body is the DHA, the Dubai Health Authority, and there are specific and well-defined objectives that medical facilities need to abide by to become a destination for medical tourism. So one of the most important aspects is certifications of the medical center, also international accreditation such as JCI, a Joint Commission International. Indeed, Dubai has one of the largest number of JCI accredited medical facilities in the world. So again, making it a popular tourist destination for medical treatment. In addition, medical facilities need to declare their number of beds, their number of physician-to-nurse ratio, and all the treatments that are available as well. So I think it is fairly well regulated, and the quality and the standard of medical care that is delivered as well comes under scrutiny from the Dubai Health Authority.
Thank you. And in your opinion, what aspects of Dubai's medical tourism model could be replicated? I know that, Rainer, you're based in Germany.
Yes.
What parts of the tourism model in Dubai do you feel can be replicated by other countries or regions? I've put you on the spot.
Yeah, it always depends on each model. There are so many diverse of those. I think the basic infrastructure must be given, the attendance of the people.
Right.
I just can repeat what I said before, and afterwards it's getting very, very specific if you're looking at the service that is provided. I think in general, let's maybe strive there another point. Dubai and the UAE is known for being very progressive, future-oriented, tech-oriented, and I think this is a huge advantage, especially in modern medicine, medicine when it comes to AI, big data, having integrated services. So something that we are doing as well. We integrate different treatments as a company with measuring and software around. And I think Dubai is just the right place to push for the future. And that afterwards can be adopted by other countries that suffer more complicated or especially slower regulations. As here, decisions can be taken on a very quick pace is a huge advantage, while in other countries the process to adopt to these new technologies is much longer, for example.
From a health provider's perspective, what strategies or initiatives have been instrumental in establishing Dubai as a prominent medical tourism hub that you are aware of? I know that.
Yeah. I mean, again, I will echo what Rouhana has said about the innovation, the embracing of advanced technologies. I think a lot of healthcare providers are kind of intimidated by artificial intelligence. Nobody wants their job to be replaced, but I think it is the future, it is the present as well, it's happening. And the way I see it is artificial intelligence is adjunctive. It is helping us improve diagnosis. It is helping us, scan multiple thousands of images, etc., something that humans cannot do. But Dubai is very good and very well placed to do this because Dubai kind of, the speed of change, it's plain to see, even kind of, buildings and development and infrastructure in the last 2 decades, Dubai has metamorphosized. And that applies to the medical field as well. I think you may also be aware that Dubai has launched the Emirati Genomic Project earlier on this year because they are moving towards, again, mapping out DNA for the local population and then beyond. So again, I think Dubai is one of these cities that really strives and embraces change rather than being intimidated by change, and is really actively embracing technology.
Thank you. Rainer, what offerings do you think are provided that can contribute to medical tourism? So specifically, you can speak about your own offerings if you'd like.
Yeah, we are the leading manufacturer for whole body cryotherapy solutions since a long time, so we know that we dominate that. But we also realized that you have to offer a little bit more. So first we started to have individualized treatments, not one treatment fits all. I think this is a huge topic in all fields of the medical. We talked about differentiation in between female and men. There is not one solution fits all, so I totally agree what you said before. But it's also age that has an impact. For example, if you talk about whole body cryotherapy or skin type, how sensitive are you to cold? So we have a software that calculates your individual treatment time. That was the first step. Then we developed another 2 products that round it up. You can hear that everywhere in biohacks, combine warmth with cold, but do it the right way. You should not sweat before going to the extreme cold. So we designed a product which we call multi-cryo hacking system, which is a composition of different treatment levels coming together. Deep tissue warmth by far infrared, different light therapy, 2 times red, 2 times blue, 2 times green, which you can mix up depending on the program and the treatment aim. Let's say you can do 80% red of the one red and 20% of the blue. At the same time, we give you oxygen ions generated by 3 different generators in a super high dosage of up to 15.6 million per cubic centimeter. Very nice for this region here, especially in this part of the year. And a quick air evacuation system, which allows us a quick temperature drop, for example, to promote collagen synthesis. So all the things are coming together. Then you go to the cryo, and afterwards we designed like an artificial lymphatic heart that you are striving in to increase the flow in your body. So all 3 things together are very nice. Then that's not all. We said, okay, there must be some measuring, give a feedback to the customers. We started integrating a body scan and a smart ring, where the customer gets a direct feedback, and you can go through that with your customer. So there's two levels. One's for a nice consultancy, depending what kind of services you provide. In the medical field, obviously more deep than if you talk just wellness. But at the same time, the customer has the same data and can compare before and after all in one app that he's using for booking as well. He will come to the point with the booking and this data. If you take the smart ring with you and you still have the logo from your Dubai healthcare provider and you're traveling back to Europe or Asia or the States, you still stay in touch with your last experience and you're eager to come back and to see how is the evolvement of these measured data compared to before. And that's just the beginning, so there's much more planned to come.
And Rouhana, Dubai has now the first hyperbaric oxygen center in the world, I believe. Does your company work close with hyperbaric oxygen treatments as well?
Many of our customers work with HBOT, and it's a super treatment, and the combination in between cold and HBOT is perfect. So we started that as a platform that shall be open for other treatments. Good that you name it. I have one customer who is at the moment conducting a study on long COVID and COPD using cold combined with HBOT. So it's a hot topic everywhere. And let's see, at the last Global Wellness Summit, there were two top topics. That was cold and HBOT in the end as technology. So that goes pretty well together.
Yes, indeed.
Thank you. So now we've discussed all the several factors that contribute to placing Dubai as the hub for medical tourism. Can you think of any limitations or challenges?
So I think one of the key challenge that patients face is sometimes insurance issues, especially if, so either the local or the international insurance, and perhaps you could elaborate on that, Mira, because you're an insurance expert.
So based on how insurance works here, obviously the only members who can purchase it are residents only. So those coming in from abroad have to already be holding something that has international coverage. In terms of medical rates, I know that Dubai versus other markets is more competitive, although those living in Dubai will tell you there's nothing here that's priced competitively. But from what we hear from the medical inflation abroad, it seems to be happening globally anyway. We do know of some patients who have come in because the provider had offered pro bono coverage, which means they came in from either Asia or Africa and they were given some pro bono work that was done to their treatment. They were mostly cardiovascular patients. But unfortunately, this is the limit to the information we have because obviously most of these cases have patient confidentiality regulations on them. So in terms of, I guess, other factors of challenges, it's hard to put your finger on it now because I think we're right now in the middle of seeing it grow and it's exploded to this really a hub for medical international patients. But it's interesting to see how the next couple of years will roll out, how we will grow, how the Dubai, let's say how investments are placed in the medical providers to encourage international patients. I know that marketing is being done abroad as well from providers' point of views. They're heavily marketing towards international patients, but it's a great space to be in right now.
I think we will face a similar development as you have it with mobile contracts, with your mobile phone. Yeah?
Right.
First, that was very concentrated on a certain country.
Right.
Now it's already areas, and you have offers that you directly have an
Correct.
international coverage for that. I think
Correct.
we'll face the same.
I mean, we
with
already have
insurance.
teleconsultation, so you already have telemedicine happening, right? So definitely, I agree. Yeah.
I mean, the DHA, the Dubai Health Authority, has launched earlier on this year the Dubai in One Day healthcare journey. And, you know, obviously they're trying to promote the whole patient experience and trying to attract patients to come and have a little bit of a leisure time as well. And then whatever their medical concerns are or their cosmetic needs are, to try to address that at the same time and trying to facilitate that. But, you know, as I said, going back to some of the barriers, one of it is insurance. Do you know of any kind of steps that perhaps insurance companies are undertaking to work in collaboration with medical facilities, perhaps?
I only know of the major international insurers that do tie-ups with providers, so therefore offering members, you know, a specific discount rate if they are availing any type of medical treatment at that provider level. But other than that, every market comes with their own regulation, so it's very hard to, I guess, narrow it down and say this is, you know, this is a one-stop shop and this is the solution for it. But there are definitely discussions from the marketing side of even insurance companies trying to tackle this to make it, let's say, more attractive for them to come to Dubai, definitely. And we're seeing that. I mean, I think every industry has seen an influx of, you know, new families, new companies opening up shop here. So it's definitely, we are on the right journey and the right steps forward.
The other thing that the Dubai Health Authority has now promoted is this like well women packages, well men packages, and focus now moving to preventative health care as well. I think the prices are quite competitive.
Yes.
And you know, they try to help patients again prevent disease before they occur by using advanced technologies, AI as well.
Yeah, because unfortunately no one is actually focusing on preventative health. It's always going to the doctor when it's, you know, you're already having symptoms, right? So for it to be covered under your insurance, it needs to be medically necessary, right?
Absolutely.
I don't agree totally on that. It's just growing from the different part. We are talking about medical and tourism.
Yeah.
In tourism, we have a long development during the last decades that it's getting more preventative, and that brings certain pressure to the medical market. At the same time, the medical market gets more like hospitality. You could see that already like 25 years ago in China. If you look at the good private hospitals, you think you enter in a 7-star hotel. Yeah? Right. So depending on the areas, and maybe to add one point, I think Dubai has another advantage. You're not so stuck in a fixed system in Dubai than in other markets, because it's more open to all different kinds of approaching a disease, which is also a nice point of differentiation. Let's say if I have a medical problem, I can get the classical treatment and combine that with other offers in a very, without having big distances, all at one place.
Yeah, I mean, to add to that, in other markets, if you want to see a doctor, you might be on a wait list. You wait months to see a surgeon. In Dubai, one of the advantages is if I want to see someone today, even a surgeon, I'm probably able to step outside right now and book a consult with a surgeon in the next 3 hours, and I'm not placed on a waiting list, or I'm not put on a months-long waiting list. And I've seen that evident in Canada only because I've previously lived there, but I think it happens in other markets as well.
Yes. Yeah, for sure.
We're happy to take questions from the audience. Yeah, please. I think there's a mic stand in the middle. Just come forward. It's questions. He has a notebook. Oh, it's only one?
Bless you, panel. Thank you so much, Mira, Dr. Feroza, and Rouhana. This better be a good question. Everyone's waited for me. My name is David Golding. I'm the founder of Sober Lifestyle Coaching. We work in the field of addiction and recovery, and we're launching a day hub this year. But my question to the panel is the growth in medical tourism solely due to entrepreneurship, or is it a true collaboration with the government where they are helping drive the growth? Thank you.
I didn't hear the whole question. Okay, just repeat the question.
Is it mostly due to government or our entrepreneurship that we're having international patients? I think it's a bigger mix of both.
Answer it.
Yeah, go ahead.
I think it's both at the same time. The big advantage of Dubai is if there is a very interesting field discovered, you have it from the governmental side and institutional side pushed in a very strong way, and platforms is given, and bringing the execution on the entrepreneurial level together. In general, you can say this is now not only Dubai specific, worldwide medical tourism, and the awareness for longevity, preventive healthcare, differentiated healthcare on ladies' healthcare, a focus, big problem that finally is focused, and so on. So it's a global development that cannot be stopped, which is here supported and even more accelerated by the government, and attracts entrepreneurs from all around the world to be based here and to have the nice infrastructure on it.
Yeah, I think it's fair to say if something is booming in Dubai, it's definitely has the support of the government. So there's definitely some immense support.
Yeah, no, so both Dubai and the Abu Dhabi Health Authority, the Abu Dhabi Health Authority is Department of Health, the Dubai Health Authority is Dubai DHA. Both of them are actively working to support and promote medical tourism, wellness, etc., through public and private collaborations and even international collaborations. So you see some hospitals in Abu Dhabi that have linked up with well-recognized international hospitals such as Mayo Clinic and Cleveland Clinic. Again, just to reassure patients about the quality of services that are underpinned by these international collaborations as well.
Anyone else?
Great discussion on medical tourism. And my question is for the panel. We have spent some time discussing medical tourism as mostly attractive for elective procedures, aesthetic purposes. But Dubai is unique. It is one of the most visited places on the planet. So should we be talking about medical treatment for tourists as part of this discussion? We have people coming in and out of the country, and those people will inevitably need care. And it's not going to be aesthetic care. It's not going to be elective procedures. They may find themselves in situations where they need acute care, and perhaps they don't have the adequate travel insurance to cover their need acutely. Because Dubai is a unique place where we are seeing such an influx of people, should there be pressure on the Emirate to develop infrastructure for treatment of tourists visiting the country? And what would that look like?
I think this is already existing. So it's a good point, but in the very beginning they said you travel for medical indications, so that is what you refer to, that I have a specific problem and I travel for that specific problem for whatever reason, because there is not the adequate services available in my country. I have too long waiting times till I get really an appointment or whatsoever. So this definitely is an essential part of medical tourism, and let's say the purest form of medical tourism besides the elective and the more well-being and preventive care solutions. There's a homepage where even is referred to different clinics in the UAE, I think.
Yes. So the DHA has also an online portal. So patients people who come in as tourists can, if they need acute care, can actually access that. So we started off with elective surgery and elective care because this is kind of, cold cases. Patients or clients coming to Dubai for a specific treatment. But of course, the government wants to support the move towards embracing all aspects of clinical care. And certainly they can do that via the Dubai online portal.
Are those at only public providers, or are they open to?
They're both now.
Oh, okay.
So as I said before, medical facilities need to register with the DHA to be able to provide this care. But certainly acute care, if a tourist goes to a public hospital, they would not be denied the care. Yeah.
Of course.
Yeah.
Go ahead.
All right. Thank you very much for the interesting discussion about medical tourism. I am in medical sales, so I'm at a high level engaged with hospitals in Dubai and other countries. And I think I need to take your opinion about what is some challenges facing medical tourism in Dubai and UAE in general, which is, even though you have the high quality of standards, and of course Dubai DHA and Siha are having great programs to promote this, but still the cost of treatment compared to other countries in the region or in Asia, for example, is slightly a big challenge. And another challenge that I need to take your opinion about is the outbound tourism. That's the locals here, especially in UAE, flying outside the country for treatments into Europe, which is somehow challenging despite the programs and the Cleveland Clinic, Mayo Clinic, all these affiliation, still it is an issue. Do you see from your expertise, any plans or programs to retain those locals? And is there any future for this, attracting more to find alternative ways for pricing and providing the value-based healthcare for other people from outside UAE? Maybe a complex question, maybe you forgot what I'm asking about.
Thank you.
First, the question is about what Dubai is, like UAE is doing, from your expertise, to retain the locals who fly outside, especially for high-end procedures, very technical, complex procedures. Still, that's an issue we see in the medical field. This is happening. And the other point is how to compete against, I would say, less expensive markets in the region, also trying to promote medical tourism as Jordan or India, definitely, or even Egypt at a very slow scale. But there is a lot of pressure on this. Thank you.
Thank you. That is a very complex question.
Yes, indeed.
I'll try to, I will start by answering the first part of it. I think the government is very aware that maybe 5 or 10 years ago, the local population seeking, themselves being medical tourists at other destinations was much higher than it is now. So it's still happening, I agree with you, but I think if you look at the statistics, it is improving. And with the launch of for example, the Emirati Genomic Project that was just launched a few months ago, it's one of the reasons, like a ploy to try to discourage the local population seeking care elsewhere. There's also now a dedicated preventative screening program for the local Emiratis, again, to discourage them from seeking healthcare outside of the UAE. But I think it's a work in progress. Again, I'm not a health authority here. From my experience and from what I know in the field, it is improving. And the governments are really committed, both Dubai and Abu Dhabi are committed to trying to reduce that to zero. The other aspect about the cost, for sure, medical treatment is costly. Equipment is costly, but I think as technology is improving, I remember when we were doing simple genetic tests for like chromosomal abnormalities for pregnant patients, the cost was really prohibitive. But now with new generation sequencing machines, etc., the cost has gone down to maybe 10% of the original cost only a few years ago. So I think with technology, the cost will also drive down. But yes, there are challenges. Perhaps Mira can answer a little bit more about the cost from an insurance point of view, but that is quite complex.
Yeah, even from an insurance point of view, it's very complex. What I was just going to add is that also bringing in all these visiting doctors from abroad, so globally renowned doctors that are brought in and then marketed through the providers that they're working at, that's part of them bringing down, locals seeking medical tourism abroad. That's one aspect of how it's done as well. With regards to expats going back to home countries to seek treatment, that's got a lot of factors to it. Does the patient need recovery time? If yes, probably would want to do it in home country where there is support from family. So we have to just keep in mind that the population is heavily expat, and those that go back to home country, it's more than just medical rates or costs. There's the recovery aspect of it. There's the comfort. If the person speaks another language and is more comfortable back home, there's that aspect of it as well. Of course, there's also the insurance aspect. If it's an excluded item or just happens to fall under the regulator's exclusion list, then going back home and paying out of pocket becomes the most next logical thing. So I think it is definitely a loaded question because there are so many different ways to have answered it. There's so many layers to it. But hopefully we've addressed your question.
Thank you.
I would add there, if there's no competition, there's no market, because you referred to the lower end and to the higher end at the same time. So I think one of the advantages of Dubai is that there's a very, very big variety of services offered. And if there is a field where the people still have a need to travel outside, that's then a sign to detect we have to get there better. And it's only good to learn there. And you never can be the best in all fields because the medical field is much too high. And on the lower end, many times you have specific markets that have a reputation for some specific treatments on the lower price level, let's say dental health, for example, or aesthetic medicine and so on, it's always a question, are you ready to pay a little bit more money and do it here in Dubai and be assured that all the surroundings is organized in a very well way? Because next advantage, here you have this organized and controlled. Or do you risk to go to a country where you might save some money, but if you're making the wrong choice, you also have to live with the results that you get out of that. So, last point to that, maybe as an idea, I think a good health concierge service can be very helpful to the internal and to the external audience, because if you have the right guidance, this in the medical field many times is the most complicated question for people that are coming from outside the sector, I feel many times.
Thank you.
Very good. Thank you very
Thank
much
you.
for the answers. Thank you.
Yes, of course.
Hi, I'm Sujan from 99 Infosystems.
Hello.
We didn't really talk too much about mental health, and most of the time when I think of this industry, the Nordic countries, even Germany actually, is very strong in that field, and during and post-COVID, lots of people have developed new mental health issues. I don't really hear about that in this area, the MENA region. Is it maybe government-based, or is it more cultural, or do you have any insight on that?
I mean, I think because the topic was medical tourism, we didn't touch on mental health because I wouldn't say international patients that were coming in were to seek that type of treatment. But it has definitely been a hot topic of discussion post-pandemic. I do know that the DHA has been, let's say, trying to pass regulation to mandate at least a minimum coverage of mental health, even on the most basic insurance policies that are purchased in Dubai. So I do know that that's underway and soon to be mandated, which would be great. So it's definitely not maybe as taboo as it was a few years ago. I think, unfortunately, we had to learn the hard way that it's an important topic, but we're definitely moving in the right direction.
Yeah, regarding mental health, it doesn't lend itself so easily to medical tourism because, obviously it is in most cases a long-term relationship between the doctor and the psychiatrist or the psychologist. So it's not like a quick fix. So, it might not be in the patient's best interest to seek medical tourism for a mental health aspect. Of course, now with post-COVID, we have telemedicine, so maybe that will lend itself to a better communication and a better long-term relationship between the doctor and the patient. But again, I think for mental health, you do want this face-to-face interaction. The patient needs that, in my opinion. I think, of course, mental health needs to be addressed, but we cannot then safely say, oh, come for mental health, and then not follow up the patient appropriately. I think that would be doing a big disservice to patients. And that's one of the challenges, I think, with mental health and in terms of medical tourism.
I think it's already there, and it was a long time before there in the third column that we talked over before. This more falls into the category of wellness, well-being, prevention, and longevity. As I mentioned in the beginning, in the Global Wellness Institute, there's an extra initiative on mental wellness already existing since a time. So it's something that is evolving. Let's say, I think we have here one famous man coming from the yoga, for example. Yeah, so that can be one way to approach mental wellness. Meditation is offered in many places. This is something where you can do a lot for your mental wellness. Cryotherapy is outstanding if you have sleep disorders, for example, or if you want to have a quick fix. The only thing I can promise you, if you do cryo, after 3 seconds, you have a cool head. Yeah? So there is many things that are already offered that contribute to medical wellness, mental wellness, sorry. I totally agree with what you said. If you have already a strong indication, a medical, psychological indication, that then probably tourism is also not the right answer, because you need a long-term treatment. That is a different story. But especially what you referred to, the impact of COVID, loneliness of the people, and anxieties that came up, there is a lot of offers in totally different directions.
Thank you. Can I add like a quick addition to that?
Go for it.
So like I said, Nordic countries do have 6 to 12 month, even longer programs to deal with.
Yeah.
Sorry. So Nordic countries do have longer programs where they sponsor the visa so you can stay in the country with the insurance that kicks in. I was just wondering whether Dubai and this area in general is also thinking of moving towards those kind of services eventually.
I think that's a movement that's going to have to be done from a government body or a regulator, health regulator. So as of now, there isn't anything that's been released in that sort. Only the aspect that I just mentioned, that they are talking about mandating it in even the most basic policies. So we have already evolved to a better, more focused mental health market. That's for sure.
Thanks.
Thank you.
Thank you. Very nice discussion. I'm Dr. Jane, Angelina Darakjian. I'm going to comment what it's been said. I'm coming years in Dubai as a functional medicine, as I said, and connected around 5 years with Open Mind Psychiatric and Neuroscience Center. We already connected with the ministry. We are connected with, mental health by all means. And we are insurance as well and medical tourism. So we are welcoming everybody. Even with the COVID, we were 24/7 working so hard online to help the community. Thank you.
Thank you.
Yeah, I believe it's a last question, I guess. So, very interesting discussion. So I'm curious to see if you face any challenges in your own respective stuff with respect to adopting new cutting-edge technologies versus trying to keep the cost low for you to be continuing to be attractive for the medical tourism. So how do you balance these two out in your respective areas? If you can comment on that.
Do you want to answer?
Specifically, what we are doing, we are having a luxury product, which is very exclusive if you want to have it at your home. Let's say this is a very, very small cap of people that can have that. At the same time, we can build the product that we can have many, many treatments with the product, which drives the treatment cost per treatment extremely down. So it's very accessible. Let's say we have customers from the public thermal bath, that's in, let's say in Europe, lowest price, and then the super exclusive place where you pay for the same treatment like 12 to 15 times more. Like with every offer given, quantity can be one factor, depending on the operational cost per treatment. I think price should not be too much the focus here. There's other places that focus on being only economic. I think here it's quality. Quality means quality of the single treatment, but also quality of the setup around and quality of the offer in a wider field and how the people are treated and so on, and to keep a certain standard. I don't know another city with as many 5-star hotels as Dubai, I think, or the Emirates in general. So I wonder a little bit why the third time now we hear price. Price is such a critical point. A good service also has a price and can have a price, because cheap can be expensive in the end.
Yes, go ahead.
Or did I not get your question in detail? I was not so sure if I'm getting the point. As you have seen, it's hard to understand sometimes when you're speaking there up here.
Yeah, just a follow-up to that, because I remember at the beginning of the conversation you mentioned that you are able to attract many people from countries like Asia, countries in Asia and other places, where generally the costs are lower, right? I understand some of the advantages to Dubai and why medical tourism is more attractive here. But I would assume, and maybe that's a wrong assumption, is cost also becomes one of the critical stuff in order to continue to be attractive. Not the lowest cost, but competitive cost enough, right? So, and that's the reason why I'm curious, because as you adopt new technologies, of course the costs are going to keep on escalating as it happens in other Western countries. So the curiosity is, how do you manage those two things? Because other countries, other European countries have not managed it, right? And that's the reason why you see many people coming or going to other destinations for care. So
we with our product we are in the lucky position that we have an answer for everybody. and you can use it in different markets. But I think if you compare the overall market, here you have technological investments in a density that you will not find in Asia in many places. At least I don't know any. They have different approaches, which makes Asia attractive as well with traditional medicine, but you find these offers here as well. But for sure, nobody will come for traditional Chinese medicine from China here to get a traditional Chinese medical treatment. No, he will come here because he has the most advanced technology in diagnostics and the super surgery robot. That is then the point. So I don't see there a direct competition.
Right.
All the other way around.
I mean, those coming here electively are coming for quality of care, state-of-the-art facilities, and they've probably reached to the providers and already received some package deal for being a cash patient, because that's how they're going to be assessed. So I think with all those factors, that's what makes it even more attractive.
Got it. Okay. Thank you. Thanks.
Thank you.
Last question.
Yeah, I think this might be the last question.
Yeah, I'll
the clock is
just make
ticking.
it the fast one. I'm Dr. Kenny from Malaysia. So I'll just like to ask a very simple question regarding information symmetry. So since Dubai placed itself at the top notch of medical tourism, one of the important information regarding informed informations and penetration of markets are actually informations. So whether or not do Dubai government actually have a registry that is accessible by public, meaning that you have a healthcare provider profiling or a professional profiling. For example, that doctors conducted how many surgeries, successful surgeries, which are the surgeries that they are competent enough, being accredited and privileged to be able to allowed by the government for the quality control purpose to access or to provide the service for foreigners or the local people. Because this kind of information will allow community outside the local environment to be able to access and compare, to do an evaluation on whether or not they want to choose Dubai as a healthcare medical tourism destination.
I think, correct me if I'm wrong, but every provider publishes their panel of doctors on their website, right? I mean, it's done with all their accreditations, everything. I mean, you can find a full profile of a doctor on each provider's respective website. So it's not private information. Correct me if I'm wrong.
That's correct. And specifically for medical tourism, the DHA will only allow providers and their physicians to go onto this portal if they've been vetted by their stringent guidelines that I mentioned earlier. So it is available publicly.
You have a DHA license,
Yeah,
I mean, at the end of
DHA
the day, right?
license. Yes, yes. Okay, I think we can.
Thank you.
I believe we're done, but that was a fantastic panel.
Thank
Great
you.
discussion.
We worked hard.
Thank you very much.